There is a real tie between the two. What is good, I think, is that the world is realizing that also. And I think there is a way to promote now both healthcare systems, sustainable and resilient health and healthcare systems, and climate at the same time, last couple of years.
Speaking around that issue, Jay, just talk to me about the Access to Medicine Index. What is this?
So the Access to Medicine weight the efforts of different pharmaceutical companies. So this is the biggest pharmaceutical companies in the world, the likes of AstraZeneca, who in the last index sits in the top 10 of that ranking. And what it and use our work in engaging with the industry. And together they manage about $25 trillion US dollars in assets under management, and they use the money to basically they use the insights to invest differently in the pharmaceutical industry to push for long-term change and a more inclusive and stronger social impact in this work. And of course, governments, many of which have been growing in the usage of our work, use it to shape their policies and the strategic investments into healthcare. By defining where the gaps are and where the opportunities are, we try to make sure that people pay attention to the most critical issues in the environment. And we're basically launching a new strategy now where we're bringing a more diverse group of players and evaluating that effort. So we're looking at big generics, medical oxygen, where there's only 6 manufacturers supplying the whole world's supply of oxygen to people all around the world. Vaccines, diagnostics, and a lot of issues such as local manufacturing, local availability is coming to light. Yeah.
Okay. Minister Reddy, you were speaking earlier on about the challenges that you faced in the context of a newly formed state and trying to respond to the pandemic. Just talk to me then about how do we future-proof health systems against those kind of pandemics that you've spoken about from a governance perspective as well.
As I said earlier, governments would have to be focusing on 2 things. One is preventive care, and the other is curative care. And looking at this from the lens of how to improve this healthcare, one would have to be talking about availability, accessibility of healthcare, and also affordability of healthcare. All these 3 would have to be moving in line. In order to do that, from my state's perspective as to how we have been wanting to move forward is, we've taken every 2,000 people, every population with every village with 2,000 population as a unit, and we're coming up with village clinics. And then we're taking up every 30,000 population as a unit, and classifying it as mandal, and where we're coming up with 2 PHCs, primary health centers. These primary health centers would have 4 doctors, 2 of the doctors present in each of the PHC center, and they would be given an ambulance, 104. And each of this doctor would be given their designated villages. So 5 villages or 4 villages, depending on the mandal size, to each of these doctors. And these doctors, every alternate day, would hop onto the ambulance and visit the village. And they would become the family doctor for that village. Very soon the doctors, because they've been designated only those 4 villages, so they would start to identify people by names. And they would use this village clinic as a hub. This village clinic primarily would be having an A&M, nursing graduate, mid-level health practitioner, and ASHA workers that we spoke about also reporting there. So that would take care of the preventive part. Now comes the curative part. The curative part would be dealing with the community, with district hospitals, the teaching hospitals. The area hospitals and the teaching hospitals are going to play a very critical role there. So there we're coming up with every parliament taken as a unit. In order to ensure that there is equitable distribution of